Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. Even though it's not all that I do in the realm of physical therapy, I'm probably best well known for my use of visceral mobilization, or mobilizing of the organs. I'm going to go through a series of podcast episodes where I'm going to talk about different organs and the effect of the rest of the body. But in this episode, I wanted to cover what is visceral mobilization, why would you have your organs mobilized, and finally, who can treat you with visceral mobilization. Only about 20% of my patient caseload is coming in to me specifically for visceral mobilization, but about 99% of them are having at least one organ mobilized during the course of treatment because it's so important. And really, it's not just about mobilization of the organs, it's mobilization of the fascia and freeing everything up. You have to kind of look at the whole body. And this is, if you listen to these podcasts, you'll know that that's kind of the thing that I harp on is you got to look at the entire body and understand how it all works together. So oftentimes this visceral mobilization component is the vital part that will help you treat the whole body, and that missing, section that is making it so that the person is going to have longer lasting efficiency. It's really crucial, but not a lot of people understand it or really know the effects of visceral mobilization. So let's start off with, what is visceral mobilization? What am I talking about when I'm talking about moving around the organs? Well, it's mobilization techniques around the vital organs to help free up those fascial connections. So when I'm going to be talking about visceral mobilization, I'm going to be talking about more dealing with the whole outside of the organ. There are different trains of thoughts that you actually are treating inside the organ and the ability for the organ to work itself. And that is a component of visceral mobilization, but that's more around the Jean-Pierre Barral kind of pathway of visceral manipulation. So when I'm talking about this, because I think it's a little bit easier to digest and understand, is that we're moving around all of the tissue, the fascia around the organ so the organ can move more effectively. Now that means that the organs aren't just thrown into the body and just kind of held there because there's other organs pushing up into them. No, they have fascial connections in what we call ligaments. Now, if you've heard of ligaments, you're probably thinking about kind of bone-to-bone connections, but that's what we call the fascial connections of the organs to other outside connections. That might be connections to another organ. It might be a connection to a muscle, but that kind of fascial network are called ligaments. So we're mobilizing the ligaments when we're doing visceral mobilization. We're putting them on tension from where they're connected to where they are to the organ, and then doing different techniques like you could just have somebody breathing, or they could be moving an arm or a leg, or just even talking sometimes to help kind of mobilize that organ. But whatever it is, you're going to put that organ on just a little bit of tension in the purposes of what I'm talking about with visceral mobilization. And then that starts to stretch that ligament and kind of bring life back to that fascia so that it moves better, in the hope that the whole organ itself can move as well. So we're freeing up that tension around the organ. Now, it is going to be most effective if you have somebody doing these mobilizations that really understands the anatomical attachments. Because like I said, there are specific ligaments. And it's about, once you learn where those ligaments are, then you can understand kind of the areas that you need to pull in or kind of push in, whatever it is to mobilize that tissue. You're going to understand the lining up of those ligament attachments and be able to move the organ in there. Now, also being able to know where these organs are and where these ligaments are will also help you realize if something feels abnormal in there, being like, there shouldn't be this line of tension through here. There's not any ligament that I know of that is in this area. So sometimes knowing where it should be also helps you be able to pick out when that just doesn't seem right. Now, you can also do this on your own as just a general lay person. I give this as home exercise programs to patients all the time. And because of the pandemic, I started doing a lot of telehealth, and I was just so amazed to see how people could do if they actually were just kind of told where they should push and pull and what it feels like to be pushing on a tissue that's not moving correctly. That kind of weird, deep feeling of like, oh, this is kind of painful compared to an area that's healthy and has good kind of springy mobility of that tissue. So you can do this at home as well. It could be anybody that's kind of mobilizing it. Now, there are a few key structures that you don't really want to go too deep with, but honestly, I haven't found anybody, but I'm sure there are because there's always exceptions. I haven't really found anybody that's gone too deep on themselves or too intense on themselves that's caused a lot of issues where it could be something really detrimental to like an organ you don't want to treat. As an example, an organ that we don't treat directly is the pancreas. The pancreas that produces insulin, it's a very sensitive gland and we don't want to treat it directly, but it is so deep that I've never seen anybody be able to really get into the pancreas on themselves and cause damage because there's a lot of other pain that's kind of getting sent to your brain before you get to that spot where you're like, ooh, yeah, that's not so good. So really, anybody could kind of treat this. You're going to be more effective if you have someone treating you that can really show you where the ligaments are, that they know where the ligaments are, but then also kind of give it as a home exercise program as well to patients and people can do it. If you look on my Instagram, there's definitely people that are doing this self-mobilizations and I give it as part of exercise programs and I feel safe about it. So it's not just someone that's specialized, really anyone can do it as well. Now, why would you mobilize the organs? Like if you don't have issues with any of these organs, why would you mobilize them? What is the point? Well, if you do have issues with the organs, you can help them work more effectively. You got to think about it. If you were to hold somebody back in their shirt, back behind them in multiple different directions, and then ask them to do tasks like lifting their arm or twisting or whatever, they can't do that motion. So the organ itself is trying to, within its kind of fascial capsule, to move to be able to produce what it's supposed to do its job that it was meant to perform. And if it's being held back because of these fascial connections, it can't do it. So you can actually help the organs work more effectively. Some places that you will see this is with digestion. So getting that transit time, if you remember back to my poop talk, I talk about how the food is moving through the bowels. Now, there's actually contractions that are happening in through the small intestines and large intestines, the stomach, to get that food to move through. But if it's held back because of these fascial adhesions, if it's kind of that soft tissue isn't working the way it's supposed to, then the muscle can't contract in this rhythmical way to kind of milk the food through the intestines, and you'll have issues with constipation. So one thing that I have patients come into me for are people that have issues with digestion, either constipation or diarrhea, because also diarrhea is probably more of that large intestine. And this is diarrhea that's not controlled by any medications. They're having issues with loose stools. Like there's a lot of other things that they might have to check out first before they come see me. But let's just say all of that's been ruled out. If someone's come to me with diarrhea, it's probably because the large intestine isn't doing its job in being able to pull out the water. So then it's just maybe because it can't really do that rhythmical motion, that peristaltic motion is what we call it, the contraction that the digestive organs do to move the food matter through. Maybe it can't pull out the water then because it's being held back by all these adhesions around it. So you can really help digestion move around further if you kind of mobilize the fascia around the organs. Yet again, I'm talking about this on the way of just moving the fascia around the organs. So don't think about I'm treating inside the organs, but I'm making it so that the organs can work more effectively. Let's talk about the liver. I'm going to do the liver as its own episode, but just kind of understanding. I've had multiple times patients that have elevated liver enzymes or really bad cholesterol get it under control. I actually had a patient who was doing telehealth who I taught how to mobilize her own liver. She was having a lot of issues with cholesterol and some other levels. And when she redid her labs, even though nothing had changed in terms of diet, exercise, anything like that, her levels were all within the normal range. But yet again, she was just treating it herself. I taught her how to do it via telehealth, so I couldn't even have my hands on her, but just explaining to her how to mobilize her own liver, and those levels came down to what it's supposed to. So it's amazing when you get the fascia around the organs moving, how the organs finally like, yes, I can finally do my job without one arm tied behind my back. The last kind of example that I'm not going to go too much into in terms of how you can get the organ to work more effectively is with fertility. I've talked about this in my whole fertility episode podcast, but mobilization of the ovaries and the fallopian tubes in the uterus can actually help with fertility as well and get better blood flow and better hormonal levels if you can just get the organ mobilizing and moving. So one of the reasons why you want to get visceral mobilization is if your organs aren't working properly. Now, here's the area that I just love is that you can help with musculoskeletal movement. So this is that whole theory of that hierarchy of the organ systems where the musculoskeletal system's kind of at the bottom of the barrel. It's like right above the skin. The skin is probably a little less important in terms of how your body can function and survive. But everything else above that, which would be all the other organ systems, so your digestive organs, reproductive organs, urinary, cardiovascular, pulmonary, nervous system, those are all way more important than the musculoskeletal system. So if that fascia around the organs is limiting the motion, your body's like, well, I'm only going to let your joints and your muscles stretch so far before I'm going to say no more, because we could potentially hurt the organs. We could be compressing on them more. We could be causing tensioning in through them, or they can't do their job as well. And so you'll find big changes in through the musculoskeletal system and in its ability to work when you mobilize the organs, when you do this visceral mobilization. In the course that I teach for the Institute of Physical Art, the IPA is what we call it, we talk about how you can treat the organs and have big effects on the musculoskeletal system. And what I love about this course, because people come into it a little questioning, wondering how much is this really going to change things? They're a little skeptical because in PT school, we just kind of learn that you need to go after joints and soft tissues if you want to affect the musculoskeletal system. But the only joint that we treat in the body in this course, the visceral course for the IPA, is the tailbone, just because of all the different fascial connections onto the tailbone, which there are 27 of them, which it still just amazes me. So you have all this connection. So the coccyx or the tailbone is the only bone that we treat, but then everything else is just mobilization of the organs. But there's no way for us to really test to say are the organs working better? So instead, we're looking at movement and we're looking at strength. And so there are certain tests in terms of range of motion or kind of core initiation and strength that we test based on what the organ we treated. And I love it because there's always there one organ for every therapist that's in the course that their eyes just light up and it just kind of clicks for them where they're able to say, oh, this is, wow, I never knew that this pain that I had in my shoulder, right up in the shoulder joint, it's so much better right now because of mobilization of the liver. All of a sudden, I mobilized the liver. We didn't get anywhere near the shoulder. We didn't treat that AC joint. We went nowhere near it. And all of a sudden, they don't have that impingement syndrome anymore. They don't have that kind of pinch and feeling stiff and through the joint because you got the liver moving better and understanding how the anatomy is all together in that. So I love the visceral course because it just really kind of shines a light on what can happen in through the musculoskeletal system. Now, I'm going to give a couple examples of organs that I'm not going to cover in my series of podcasts, but just to kind of give you little snippets of how kind of cool this is. So this was actually a participant that we had in a course back in 2020 where it was really cool. He had close to 6 knee surgeries onto his left knee. And he just really felt like he couldn't accept weight really there. And when he was walking, especially the end of the gait cycle where his heel's coming off, he just felt like it was just really short because he just didn't have length through his quadriceps. He didn't have length through the front of the leg. And he just felt like if you were ever trying to push him over, he just could not accept weight onto that leg. And it was amazing to see after we treated the sigmoid colon. So the sigmoid colon is the end of the large intestine, and it's sitting right inside the pelvis on that left-hand side. We treated out sigmoid colon, And the first thing he could say is, oh my goodness, my walk is so much longer, because his pelvis was now able to rotate back because it wasn't holding on to this restriction that it had through the sigmoid colon that was limiting how much hip extension he could go into. So once we mobilized that, he was able to get this crazy hip extension in through there. And we really dove in deep into that area. And as soon as we kind of got over to the rectum, so where the sigmoid colon then goes to the rectum, and treated through there, we were able to test out his core function and seeing how he could accept weight. And if he had this lumbar protective mechanism, if he could, when you try to push into him in a staggered stance, if he was able to hold strong. And man, he just felt like his leg could accept so much weight and he was so much stronger. Because what was happening every other time in the class, and this is, the end of, or the beginning of day 3 is when we're treating this area. Every other organ we had treated, his knee would kind of collapse. When we were trying to push him over, it was his knee that was giving out. It just couldn't accept this weight of getting pushed into. But then all of a sudden you treated out that sigmoid colon, that end of the large intestine, his hip was able to go into better extension, and he was able to activate his quad muscles and accept that kind of force that was pushing through his trunk. So it's amazing. I didn't touch his knee at all. I didn't go anywhere near his knee. I was a full femur away from it, and it had huge effects on how his knee was functioning. So the sigmoid colon, or on the other side, it's called your cecum, which is the start of your large intestine. You can improve someone's hip extension so much more, and thus improve their knee extension as well, and just kind of that overall gait mechanics. Now let's talk about the kidneys. So the kidneys we don't teach in any of the courses that I teach, but anybody that comes in and they always have this pain around their back and something called their QL, or quadratus lumborum. Now, you might be like, quadratus lumborum, but if people have QL pain, they know the term QL. They'll hear it from their massage therapist, they'll hear it from their physical therapist, and it's just never relaxing. That QL just never seems to get out of this state of contraction. It's always holding on for dear life. And that is because of the kidney. It could be the kidney just off to the side. So the kidney is literally just to the outside of that QL, and it has tons and tons of fascia around it. The best way I ever heard it described, it was as if the kidney is in a long tube sock where the toe is the higher part of the kidney, and that tube sock is going down all the way down into the pelvis. So it can easily just be held downwards and not be able to lift upwards. And so if it has that pressure down on it, what you're going to do is, if you think about it, if you had a tube sock right there and you pull the tube sock down, it's going to put you in a little bit of a side bend. And what's going to contract that QL? It's just going to kind of stay in the state of contraction, because if you were to try to lengthen that side, you'd be pulling too much on the fascia around that kidney. And that kidney is going to say, no, 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 no. Like, you're going to be, possibly hurting us. And we need our kidneys, even though we have two, you need to have both of them working as effectively. And so you'll find people that have this really tight QL, but it's actually the fascia around their kidney. And that kidney has so much extra fascia around it because it's actually not protected within the abdominal contents. It's something that we call retroperitoneal. It's outside the peritoneal cavity. So it doesn't have this nice cocoon of multiple layers that are helping to protect it. So it's had to create its own little cocoon with the form of this fascia that's kind of like a tube sock. So patients that have this QL pain that just never quits, that QL that just never relaxes, no matter how much they have it, they stretch it or they have it worked on, it could be their kidney, the fascia around their kidney, and their QL is just holding on for dear life to try to protect that more important organ system. So you'll see big improvements in range of motion and strength with mobilization of the organs, even though you haven't gone and treated a joint at all. So this is why I say that only about 20% of my patients that come in are coming into me specifically for an issue with their viscera, an issue with their organs. But 99% of them is getting a mobilization of the organs. The only time they really don't seem to get a mobilization, if I'm treating someone for a hand or elbow, sometimes It's not, affected by the shoulder, which is affected by other range of motion. So that's why there's that 1% that they're not getting a visceral mobilization. And it's, but ankles and feet, you better believe I'm going up to the pelvis and checking it out. So it's really my hand and my elbow patients that specifically just a hand and elbow. There's not any other cause that they're not getting this visceral mobilization. Everybody else, guess what? You're going to get an organ treated. And it's the fascia that around the organ that I'm treating so that all the rest of the fascia can move better and have greater mobility. But remember, it's because of that hierarchy of the organ system. Going back to episode 1, I know I always reference it, but it's such a huge kind of building block of what I think about with physical therapy is that hierarchy of the organ system. So your body's just trying to protect those more important organ systems above musculoskeletal system, which is basically everything except for the skin. So visceral mobilization, why would you have it done? Because you have pain and limitation in your body. Most likely you're going to get an organ mobilization because it's somehow impacting how your body's not functioning efficiently. And I want to bring you back to efficiency. Now, who can treat this? Well, I kind of already alluded to this, but really anyone that does body work can work on this area. So in the IPA, in the Institute of Physical Art, we only let physical therapists take the coursework, but other coursework, like I've mentioned, Barral, Barral, really anybody can take Barral work. They can kind of learn about the organs and understand this visceral manipulation. So you really want to go and try to find an area that works well for you. If you're a physical therapist, you can do the IPA courses. If you want to learn more, you can kind of go into these Barral courses as well. So anyone that does fascial work can really work on this. You're just moving around the fascia. If you don't know the anatomy, then you can't really go as deep. So you want someone who can really specialize. If this is something that you really think is a problem for you, you want someone that really specializes in the area, and you just search for them. Keywords would be visceral mobilization and visceral manipulation in terms of what you're looking for when you're trying to find a body worker. And you can always call the location and ask them and see what kind of training they have. You can just say that you feel like maybe there are some adhesions around your organs and you think that should be addressed. Do they have any experience with that? And if they do, they'll let you know. But there's different, you can search in through the Institute of Physical Art for a therapist that's near you. Under Barral's work too, there's a website for him, and you can find a practitioner in your area as well. So just search them out, but then don't be afraid to call and see if they do the work as well. But remember, there's also things you can do on your own. I have a bunch of those on my Instagram site that I feel like are really safe to do for self-mobilizations. It's not something that you need to have an expert degree in. I only put the ones on there that I think are, pretty much foolproof, that I don't see you doing anything really bad to yourself. I don't post the ones that I would really want to show a patient myself because there is some risk, especially with different medical conditions that could be going on. But for the most part, there's a lot that you can do on your own. And I think it's really great to see via telehealth how so many patients have been able to help themselves once they understand kind of that root cause a little bit more and how that organ and that fascia around the organ could be affecting it. So don't be afraid to kind of play around yourself with some of this and see where, if you kind of tug and pull in different areas, because it will feel sharp, it will feel uncomfortable if it's an unhealthy tissue, and then just kind of do some movements and see if you can go around there. So we'll go over some of these more as we go into the series of podcast episodes. So right now, what I am figured out that I'm going to talk about is first the stomach and the esophagus, and then the next one would be liver and gallbladder. And I've talked so much about female issues, and my husband's like, you got to talk about male issues too. So we're going to talk about the prostate and the bladder because, man, that prostate, that's like the last thing we do on day 3 of the course that I teach. And those men's eyes are lighting up, not just because you're mobilizing their prostate, but when they stand up, they're like feeling so much better. And they could honestly be like belly dancers and their cores are firing, and it's all from just mobilization of the prostate. And don't worry, it's external. It's not internal that we teach in that course as well. So we're going to talk about those in the next kind of series of different organs. If there's something that you really want to know about, just send me a message on Instagram. If there's an organ you really want me to cover in this series, it's Superior Performance PT, or you can just kind of search my name. It should come up there as well. But I'm looking forward to teaching you guys more about mobilization of the organs. for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.